Welcome, everybody. This is the University of Applied Research and Development's podcast, an emergency response and risk management. And I'm delighted to have the honour of Tom Godfrey with us today. He's the Emergency Operations Manager for the Operations Partnership. Hey, Tom.
Hi.
Great to have you with us.
Thanks. Good to be here.
Why don't you tell us about your role, what you're doing, the partnership, and how you came to be there?
Sure. Currently, I'm an Emergency Operations Manager working on a program called Tackling Deadly Disease in Africa project. It's funded by UK government through DFID. So I'm placed by the Operations Partnership into DAI. We're focusing on 6 countries in Africa at the moment, more broadly in terms of helping them to improve their national health security, improving their response architecture, and working with ministries of health in each country. We've obviously had to rethink with COVID-19, and at the moment we're trying to gear up projects across 6 countries, so Chad, Niger, Mali, Uganda, Ivory Coast, and Cameroon, and work with local NGOs in those countries to deliver activities which will help to reduce the spread of COVID-19 in those countries.
And is that a shift in the goals of the program, or is it a new program?
It's shifting from originally we were intending to have a mechanism to intervene early on in epidemics. So it was an early response mechanism, focusing on the ability to spot new epidemics at grassroots level amongst the communities and support grassroots organizations to intervene together with district health authorities in a timely fashion. We'd spotted a gap in terms of funding in the early stages of epidemics. Funding tends to come later on when the situation is much worse. So yeah, we've had to rethink, and we're responding in a different fashion because of the exceptional nature of COVID-19.
And in the countries that you're working in, is there a sudden burst of contagion, or is it being managed? What's happening with your project countries?
The worry in those countries is that we have much less visibility than we would in perhaps Europe, and it's largely because of the limitations in terms of identifying cases and testing, widespread testing. So, you know, when you hear a number from Cameroon, for example, where there's already quite high numbers, you can expect that the real numbers are several orders of magnitude greater than the numbers that are being reported. So it's hard to get a really good picture. But certainly the pandemic is going to affect those countries very, very severely. And the worry is that in those countries we've got very limited health infrastructure, and it's not just the impact of COVID-19, it's also the impact on other diseases which will be neglected. For example, vaccination campaigns may be disrupted. We may see people don't have access to basic primary healthcare services that they would have been before. So we expect mortality rates indirectly to rise as well as a result of this.
So what sort of things do you focus on when you do these projects? You're looking at people, you're looking at funding, you're looking at infrastructure. Explain to us kind of the nuts and bolts of what you'd look at.
Yeah, I mean, the project that I'm on now is probably different to the humanitarian work I would have been doing with Save the Children. This project is very much focused on supporting local organizations to deliver through various activities that would be aligned with the Ministry of Health's COVID-19 contingency plan. There's various pillars to those plans, which include sort of public health, messaging, training of health workers, provision of PPE, case management, supporting with isolation, and those types of things. You know, measures that we're seeing in all around the world, supporting those measures to be taken to be put in place at a timely fashion. Some of these countries where it's harder to deliver those things.
So you've had a wide experience. You've been in Southeast Asia, where I am, and now you're in London. So in your travels and in the projects that you've done over the last period of time, where do you see the persistent gaps in emergency response or emergency management?
Yeah, I spent 3 years working in the Singapore office, which is Save the Children's regional office. From there, we oversaw several dozen significant emergency responses, including the Nepal earthquake, the Haiyan response in Philippines, and the Rohingya crisis in Bangladesh. Previously, I've been working, on Syria, on the Syria response, Haiti earthquake response, the Libya response in Tunisia, and various other responses around the world. In terms of persistent gaps, I think we're getting better as a humanitarian community in terms of coordination. One of the persistent gaps is probably linked to the Grand Bargain and the commitments there to implement increasing proportions of our work through local partners. And I think that we're not very good at doing that in a considered way. And I think that the tendency still is that international NGOs leave it till very late before aligning partnerships. And partnerships with local actors tend to be fairly utilitarian. So the partnership would be for the duration of the response, and at the end of the response, it might end. Whereas if we were serious about making this more sustainable, we would invest in those relationships much more beforehand and much more afterwards, and help local actors to get to a point where they're perhaps less dependent on the international NGOs to support them to deliver. I think supply chain is another challenging thing in any crisis, and there's sort of big drive to improve civil-military coordination, which I've been involved in both in Asia and elsewhere. There's a lot of military assets which can be repurposed for moving aid, and that needs to be properly coordinated with the UN and the NGOs as well. So I think that for me, the key is coordination, and there's room for improvement on many fronts, both in terms of civil coordination, in terms of coordinating with local actors, and NGOs ensuring that they coordinate properly with national governments.
What would be one of your most successful projects or responses that you've been involved in, and what made it successful?
There's a couple of examples. I particularly liked our response in the Pakistan floods in 2010. I was down in Punjab, based in Multan, and there were very serious floods affecting huge parts of the population. And the reason that I think it was a successful response is the same as some other responses I'm thinking of, and it's because as with Save the Children at the time, we were running a multi-sectoral response across 7 core sectors, which was providing food, but also providing medicine, providing child protection support, education support, shelter, and I think that when you can provide a holistic response to an emergency situation, I think that the results are always much better. We call it integrated programming. So rather than trying to achieve maximum beneficiary numbers by perhaps providing food to 1 million people, perhaps with the same budget, you can target 100,000 people and they will receive food and shelter and education and health support, across proper quality response and across many sectors. So that's something that I know Save the Children and other organizations are wrestling with, because to deliver a quality integrated response, your perhaps beneficiary numbers will be less, but the overall response will be of better quality. And that comes back to where coordination is really important. So quite often we're seeing, I'm thinking back to the Haiti response, which got a lot of bad press, but we did some good things too. I was there from day 4. We were right at the beginning. We sort of divided it up geographically between not just international militaries. I was down in Leogan where the Canadian military were running things, but also by NGOs. So we had districts each, and that allowed us to take a section of the community and deliver aid in all different types of sectors. So you'd go into a part of a camp and you'd see Save the Children would be providing all the basic services for them, rather than it being coordinated across different NGOs. And the same was the case in Cox's Bazar. I was up there for the Rohingya refugee response, and we were given, I think it was the UN were coordinating the NGOs to divide up the sectors of the camp. And once again, the best approach was deemed to be giving NGOs responsibility for a specific sector and requiring them to, where possible and where they've got the strength, to provide services on multiple aspects at the same time. So that tends to work quite well.
So I guess the discussion is, do we want to have maximum people get food, or do we want to have a smaller number get food, shelter, education, protection? And so I guess that is a hard discussion to have with different values perspectives. What do you think is the better way to go?
I think it's a question of targeting properly, and defining your beneficiary selection criteria at the beginning of a response is really key. Quite often NGOs, and I know I'm talking from a Save the Children perspective, would prioritise female-headed households, pregnant and lactating women, disabled, child-headed households, trying to prioritise the most vulnerable of the population, and ensuring that they're prioritised for aid, as opposed to a sort of blanket approach, which is quite often applied in refugee camps. And I don't think we'd ever want to have a situation where it's a trade-off, where we would reduce the numbers who overall get aid. I think it's a question of organising amongst the actors, because these days in big emergencies there are an enormous number of actors, and quite often coordination is as much of an issue as the amount of resources that are available. So if you can get coordination right and get targeting right, then quite often that's the foundation of a really good response.
Right. So Tom, if someone was wanting to make this their career, to do the things that you've done, to work with you, what would be some of the things that you would suggest someone new who's just maybe heading into university or heading out of university, training experiences? What should they be looking to do to build their own internal capacity to do a good job?
I think really to go into the humanitarian world, I think you've got to be passionate about it. So I think that you'll already know if you're passionate about it, and I think if you are, you'll already be reading about it. You'll be well versed in what's going on, and I think that gives you a massive head start if you're able to talk about that convincingly to potential recruiters. I think secondly, obviously relevant degree helps. I did a sorry, my son's just walked in, working from home. I did my master's in international development, which obviously helps too. I think the other thing is being prepared to be flexible and perhaps offer your services pro bono for a period. I think that helps a lot of people to get a foot in the door. A lot of NGOs have got obvious budget restrictions, and if you've got parallel expertise and transferable skills, whether that's sort of accounting or HR, or remembering that these NGOs run like any other business in many ways. They need the basic skill sets that any business needs. If you've got transferable skills that you can offer to an NGO, I think that can be a good start. I started off as a volunteer. I was in Tanzania, and I offered my services to Save the Children and worked for them for free for 3 months, and subsequently got a job with them. So although obviously not everybody wants to or can afford to work for nothing for long periods, if you can sort of offer services, even if that's sort of advisory whilst you do your other job, that can be a good start and get you those connections.
Yeah, that's really good. That's really good. Hey, so Tom, if people want to follow you and look at what you're doing and look at the projects and just keep up with you, where's the best place, or where are the best places to follow what you're doing and the projects you're involved in?
Sure. I'm not particularly prolific on social media, but feel free to look at LinkedIn. On there's a link to the project I'm currently working on. And yeah, if anybody has any questions, feel free to ping me on LinkedIn.
Tom, thank you so much for your time. You have a fabulous day working from home with the kids.
Thanks very much.